Diane Voss again. We're going to talk about vitamin D today. Vitamin D is essential to our bodies, and our bodies can't make it, so we have to get it from external sources. And we can get it in our diet, and of course, if we can go outside and get it in the sunshine, that helps a lot too. And the light on our skin causes our skin to make vitamin D. It has several roles in our body, but the main thing is to keep our calcium levels where they're supposed to be. It also helps our intestines absorb calcium from the foods we eat, and that increases the amount of calcium in our bodies. If our vitamin D levels are low, then our gut has a very difficult time absorbing the calcium. That's why we fortify milk with vitamin D. And did you ever notice that all the milk that you buy says vitamin D fortified? That's the reason, because a lot of people are a little bit low on it. We want our kids to drink milk so they get lots of calcium to build our bone, but without vitamin D, that's really not that helpful, and it will go right through. And that's one good way to tell whether the supplements you're taking are actually being effective or not. If you take a calcium supplement and you get constipated, then you know for sure that that calcium is staying in your gut and not getting into your body. And so what a lot of people do is they take magnesium with it, but magnesium, like milk of magnesia, gives you loose stools, and you know you're not absorbing that magnesium because if you're getting loose stools, obviously it's staying in the gut. So the type of calcium and the type of magnesium that we take makes a huge difference on how available it is to our body for absorption from the gut into the body. Calcium citrate, calcium alginate, all the other different types of calcium besides calcium carbonate are going to be absorbed better. And part of this also has to do with molecule size and what it's attached to, because everything in your body, when we get these compounds, they have a positive charged part and a negative charged part. So if you put a little magnesium molecule on oxide, the oxide is a big molecule, so it stays in your gut. If you put a little magnesium molecule on a citrate molecule, that citrate's a smaller molecule, so it goes through better. Now, interestingly enough, the only magnesium that actually crosses the blood-brain barrier is magnesium threonate. So depending on what you're trying to do, how you take it makes a big difference. So if I'm a little constipated and I need some natural help, I would want to do magnesium oxide because it's going to relieve my constipation, but it's not going to do much good for my heart or anything else. If I'm having a lot of migraine headaches, then magnesium threonate is going to be better because it crosses the blood-brain barrier. Magnesium threonate also helps quite a bit with anxiety. And when you're getting appropriate magnesium that's the absorbable type, it does help you absorb your calcium and it helps the calcium get into the bones. So all these things are connected, which is why a lot of times taking a single supplement is not necessarily the best approach. Everything's kind of designed to work together. So it's very important in the absorption of the calcium and in the regulation of the calcium between the blood and the bones. So if we increase somebody's vitamin D levels, it increases the amount of calcium they're able to absorb. And you know, in the United States, we take more calcium supplements than any other country in the world, and we still have the highest rate of osteoporosis. So there's other things going on here. So carbonate is one of the things that calcium attaches to. And so when you drink soda, which are carbonated, the carbonation in the soda binds the calcium and it helps take the calcium out of your body. So one of the great ways to slow down the bone loss is to increase your vitamin D and to quit drinking carbonated things. How interesting is that? So some technical but important information. There's two different forms of vitamin D in the blood. There's the vitamin D25 and the vitamin D125. Now we measure the vitamin D25, it lasts longer in the blood. But this is a sad thing. The reason we measure the vitamin D25 is because that's what Medicare will pay for. So when I was young and right out of school, I thought, wow, it's really, really important for us to know vitamin D2, which is not the active form, vitamin D3, which is the active form, and vitamin D3 125, which is what the body is actually using. So I was ordering all those, so I got a really good picture of what was going on with my patients and what part of the pathway they were having problems. And then I had a lot of angry patients because they were getting bills from their insurance that would only pay for the vitamin D325. So, you know, sometimes we're stuck in a position where we do things because it's what we're allowed to do, or because it's convenient, or because it's cheap, or because it's what will be paid for. But in reality, in certain cases, it is useful to get all those different pieces of information. I don't think you need to do that for everybody, because if everything's where it's supposed to be, all you need to do is check the one thing and you know where you are. Another thing that's kind of important to know is that vitamin D is a fat-soluble vitamin. So if you get a tablet that has some coconut oil in it or something else that helps carry the vitamin D, it's probably going to absorb it a little bit better than if it's in water. The other thing is there's 4 vitamins in the body that are fat-soluble: A, E, D, and K. And because those are fat soluble, they can build up in your body. You're not going to pee them out every day. So that's why sometimes it's okay to take vitamin D, a couple pills here and a couple pills there. If you can't remember it every day, try to remember it twice a week, but take a larger amount. There is a limit to what the body can absorb in any one day. So if you take 100,000 milligrams of vitamin D, and don't do that, it's way too much, you wouldn't absorb that much. So you're going to have expensive poop and expensive urine because you're taking more than the body could possibly handle. If you got 10 gallons of water and you only got a 5-gallon bucket, having 10 gallons of water is not going to help you very much. So the important thing is that the inactive vitamin D25 is converted to the active form in the kidneys, and this activation is much faster and more rapid in people that have parathyroid problems. So if somebody has a very low calcium and high vitamin D, then we probably need to look at their parathyroid glands or the PTH hormone. Almost every patient with primary hyperparathyroidism due to a thyroid tumor, an adenoma, or something like that, will have a low vitamin D. And this is important that if you have that with a low vitamin D, and I think I just said it backwards, if you have a low vitamin D and a high calcium, then we should look for the parathyroid tumors or adenomas. So it's kind of interesting that vitamin D, unless it's fortified, is fairly difficult to get in the diet. It's much easier to get it in the skin and to activate it in the skin. So one thing I want to talk about a little bit is how important this is. And again, there's a question of what is actually an optimal value versus what's a normal value. So my understanding is back in the day when they were trying to get normal values, they just go out in the street, catch 1,000 people and draw their blood, and they make a nice little bell curve over what those levels come back at. And so there is such a thing as normal versus optimal. So when you go to a regular doctor and get your blood drawn and your level comes back at 30, they're going to tell you that's okay because their lab level says between 31 and 70 or 100 is normal. What we're finding is that people actually do much better when they have values at 50 or above. Because it's a fat-soluble vitamin, you can get toxic with it. I really have not had anybody have any symptoms with that. Other than I did have a lady whose level was almost twice what it was supposed to be, and she was having itching of her scalp, which not quite sure exactly what the cause of that. I'm sure there's an obvious explanation, and I didn't get that far on Google or my textbook, so I apologize. But if you have an itchy scalp, checking a vitamin A level and a vitamin D level, those both can be associated with that, among 100 other things. So some things that are interesting is how well you absorb vitamin D actually has a genetic basis. So we know that people of Middle European descent sometimes have a more difficult time absorbing their vitamin D, and they're a little bit more likely to have osteoporosis because of that. And I'd always found that there were certain patients that they'd come in and go, I'm taking 10,000 units, and their levels weren't budging. And I said, well, change brands of your vitamin D, because there's sometimes a huge difference in the quality of vitamins. And in some people, switching brands made a big difference, and other people it didn't. And as I was going through some ancestry data on genetic SNPs, I discovered there is a gene that actually is in charge of how well you absorb your vitamin D. It's called the VVR SNP. And if somebody is deficient in 2 of those, they don't absorb vitamin D very well at all, and they need much higher dosing. In general, the average person who is low needs between 2,000 and 5,000. I have had some people that have had to take 10,000 units at a time. What I find is that if your vitamin D is low, it's hard to lose weight. So sometimes just increasing your vitamin D does make it easier to lose weight. Everybody keep track. If you have nephrotic syndrome, very often you'll be losing vitamin D. Vitamin D levels are low if you're not absorbing things in the gut very well. Crohn's disease, Whipple's disease, cystic fibrosis, celiac disease, gluten intolerance, and liver disease also all make it very difficult for you to absorb it, even if you're taking supplements or getting it in your food. So those are some of the causes. Wearing sunscreen a lot, where you are in relation to the sun. People in the way northern and way eastern latitudes have more difficulty with low levels than people around the equator, of course. And then when it's wintertime and you're like me and you cover up because you're cold all the time, you don't get as much exposure. Consequences, if you consistently have a low vitamin D level, you're more likely to have Alzheimer's. You're at higher risk to develop schizophrenia, more likely to be depressed. And interestingly enough, for those people that have seasonal affective disorder, getting adequate vitamin D is more helpful than any medication that I've been able to find. So I always, in these people, there are some people that when it starts getting gray, I have them take extra. And when it starts getting cold, I have them take extra. I do check levels to make sure that we're in an optimal range, because like everything else in the human body, there's always too high, too low, and just right. Goldilocks was right on there. So it's also important in your neurocognitive abilities and how you problem solve and things like this. And now most of these studies were done in mice, and so extrapolating that to humans is probably a little bit more difficult. But I do have a lot of patients who tell me once I get their levels up to about 60 or 70, like, I think my memory is a little better. And at this point, whether that's true or not, if they believe it, I'm all for it. It's a real easy and non-toxic fix for that. I do know that my patients who are taking their vitamin D almost never get sick. Their incidence of respiratory infections goes way down. People that have low vitamin D statistically are more likely to get influenza A, statistically more likely are susceptible to get tuberculosis. People that have asthma that aren't keeping their levels up do have more asthmatic attacks and more wheezing and allergic wheezing as well. There is some evidence that low levels are more likely to predispose you to high blood pressure and to congestive heart failure, as well as heart attacks and peripheral vascular disease. Apparently there's something about the endothelial function that may change when the vitamin D levels are very low. It's also clear that people are more likely to develop metabolic syndrome and diabetes when their levels are consistently low. In women who have low levels, more likely to develop preeclampsia, which is where you develop high blood pressure in response to the pregnancy. It's not a good thing for the mom or the baby. And when it's something that's so easy to get into a functional range, it's really a shame if we're not doing everything we can in that situation. Certainly everybody's aware that your risk of osteoporosis or thinning of the bones is much higher, again, because you're not absorbing your calcium and you're not helping the calcium get into the bones where we want it. We don't want calcium in the blood because then you're going to get kidney stones. We want our calcium in the bones so we have nice, strong bones. People that have low vitamin Ds are much more likely to have muscle aches, they're much more likely to have joint aches, much more likely to have muscle weakness. It's not uncommon for me to have people that say, I just hurt all the time. And so we usually are doing a couple of different things, but if I have somebody with a vitamin D level down in the teens, I can guarantee you they're having achiness. If we get their levels up, they feel much better. Osteoarthritis seems to be worse or more symptomatic in people with low vitamin D. Softness of the bones or rickets, it's clear, that's the classic thing where vitamin deficiencies were first described back in the dark ages. It's clear that there's about 17 different types of cancer that are more common in people who have low vitamin D levels. The significant ones that come up most consistently are breast cancer, colon cancer, prostate cancer, and pancreatic cancer. Again, there's a lot of things we can do to decrease our chances of these type of things, and this is something that's easy and non-toxic. People are more likely to get autoimmune diseases when their vitamin D levels are consistently low. That includes type 1 diabetes, multiple sclerosis, Crohn's disease, and rheumatoid arthritis. So I'm a big fan, in case you haven't figured out, of checking vitamin D regularly to make sure we're not too low or too high, and taking it as you need it. And I think that's about how I have to say on the subject of vitamin D. There's a lot of information out there, and I always encourage people to don't give away your power by believing everything you hear, but do go and get some information on this kind of stuff and kind of protect yourself and take charge of your life, because it makes a huge difference. Thanks.